Good evening, everybody. Meeting again with the Materia Medica session, where we have discussed three remedies of till now. We have started with Alimsipa, then we have discussed in comparison the Euphrasia. Last lecture we have discussed the Arnica. So we have discussed the Arnica, a remedy from compositive family, a remedy for injury, and a specific type of injury, that is the blunt trauma, where there is a sore bruised feeling around many times, petechial hemorrhages which used to happen over there. That aspect, along with different cases, we have discussed Arnica, a very important remedy in day-to-day practice. When every accident, there is a role of Arnica. So I considered that when we think about the injury remedies, why not to compare all injury remedies? Basically, those are there in your syllabus of second year. Why not to compare? Because, are you not getting my voice? Is it clear or
Now clear, sir. Now it's clear.
now it's clear? It's
Now it's
because
clear,
of
sir.
some issues. Okay. So I thought that it's always better to compare the remedies, injury remedies, and so I have decided today to discuss one more important remedy which is very useful in day-to-day practice. The remedy which I have used in a different manner. Basically, what happens when we think about the calendula, a remedy from the same compositive family, common name is marigold. We think only about the injuries, we think only about the lacerated wounds, and we forget the rest of the action of the remedy. Yes, it's a role, it has 100% role in all varieties of the crushed injuries, lacerated injuries. Whenever open injury and ulceration is there, calendula plays the role, and it is the only remedy which I have seen that which has the capacity to develop the granulation tissue for the purpose of healing. So it is always better to go for this remedy with that aspect. But if you would have opened your Borix Materia Medica anytime, you have open the just a dose part. What he has mentioned about the calendula is very important, and that aspect I have used in many times in many cases, and that I want to share with you. What he explains over there regarding the calendula in the dose part, that it is locally used remedy. First sentence, aqueous calendula for all wounds, the greatest healing agent. Yes, this is true. Also as an injection in leukorrhea, underline this. Internally tincture to third potency. This utilization of calendula I have used to do in day-to-day practice. It is the wonderful remedy for the vaginal candidiasis, leukorrhea, because of any origin. Calendula in a around a jar of water, that is while using the bath we used to use that jar, that in that you mix the 20 drops of mother tincture and ask the patient to wash the vagina, those who are having the leukorrheal discharge or vaginal candidiasis or severe itching. It is one of the important remedy for the vaginal candidiasis, and it never fails. It is the remedy which heals that. This part I want to share with you. I have treated many cases. In fact, I am treating many cases. I have treated not, I am treating many cases with the help of this thing. And this is wonderful for that purpose. So this is one aspect I want to share with you. Second, any deep chronic wound, non-healing ulcer, whenever the tissue loss is much more. I will share one case. I was there with Bagli Hospital in 1990. One of the close friend of my sir, he was admitted over there having an fracture neck femur, and he was operated for the for that, And next, third day, he got a severe myocardial infarction. After myocardial infarction, he was absolutely bedridden, and I, unfortunately, after 3 4 days, he had a big abscess over the sacral region. It was so big, it is a bed sore, infected bed sore, and a big abscess, as if this whole fist will go into that. That much severe abscess was there, because he was getting often on fever, and sir was always in an anxious mood, because he considered whether it is wrong with the x-ray, whether it's surgery, but surgery was good, nothing wrong with him. And then it has been found that he had a bed sore, and when it has been checked, there was a big abscess, so it was drained. My sir told me, Prasad, it is very difficult to survive him. I don't think it will heal. It is so big. He is having diabetes along with that. It's very difficult. I said, I talked with him. I said, sir, we will use Calendula mother tincture over here. And I'm quite sure it has capacity to heal that tissue. And to his surprise and my surprise, the whole big abscess recovered completely within span of 15 days. Completely, absolutely healed. This is the power of calendula, which has a capacity to generate the granulation tissue, and that is the healing tissue. So any wound, crushed injury, lacerated wounds, wherever there is a tissue loss is there, and if you want to repair with the first intention means if you learn the pathology, uh, you can get very easily the repair with first intention, very fast healing agent. So it never keeps any scar, and it heals so fast. That is the capacity of this calendula. So I have used it for that purpose. I have used it for the fungal infection, for local application, and it heals that fungal infection. To kill that fungus, calendula works. So calendula mother tincture plays a very vital role externally as well as internally. So these are two important things. Third important thing for which I have used this remedy, it has been said by many friends of mine, sir, whenever there is a damage to the tendons, or whenever there is a tendon damage to the cartilages, does it heal? I said, yes, it heals. And I used to use internal calendula for that purpose, along with, if needed, arnica or a ruta. This is the healing agent. So it heals by locally as well as given internally. It has the capacity to repair the muscles. It has the capacity to repair the tendons. It has the capacity to repair the meniscus. And that's why this is a wonderful remedy one should utilize in their practice off and on. So we'll discuss what the Allen says about it. So let us go ahead with the Allen's. Calendula marigold compositing. Traumatic affections to secure union by first intention and prevent separation. Yes, first intention healing, very fast healing agent. But one more preventive role is there, that it whenever you apply the calendula, there is no separation happens. I have experienced it for consecutively 2 years in Bagli Hospital. Whenever we used to do any surgery over there, he used to do any surgery, we used to add the calendula mother tincture over there, and we used to pack that, because it prevents the suppuration and it heals with first intention. Because surgical wounds are always clean cut wounds, and whenever clean cut wounds are there, they always heals with first intention if healing occurs properly. So that is first important thing which he has mentioned. Second, in all cases of loss of soft parts, underline this. Loss of soft parts. Very important word. So whenever there is a soft part is lost, it plays a very vital role. it heals with granulation, that part. My suggestion to all of you is that you please put off your videos because that connection matters. You keep your audios on if needed. Please keep your videos off so that it will not disturb the flow. Connection gets disturbed because of it. So Dr. Keshav, Dr. Raut sir, please keep your videos off. Okay, thank you. In all cases of loss of soft parts, when union cannot be effected by means of adhesive plaster. So this is one more thing which you have to take into consideration. The only adhesive plaster is not effective. Here for the purpose of healing, this is two important thing which you have to follow over there. So this is one important thing. External wounds with or without loss of substance. Injury happens externally with or without loss of substance. Torn and jagged looking wounds. It is as if torn, the skin is torn, as if irregularly torn. Post-surgical operations, post-surgical clinical. It has been given by him in italics. Whenever he explains in italics, it has a meaning. Whenever it has been given in italics, yes, definitely it works. So this is again too important. Atharva, please keep your video off. To promote healthy granulation, see, very important pathological aspects he has mentioned over there. To promote healthy granulation and prevent excessive suppuration and disfiguring scars. Yes, granulation tissue you can produce, you can stimulate with the help of calendula and prevent excessive suppuration. So it prevents the infection over there, secondary bacterial infection. And second important thing, it prevents disfiguring scar. So scars also prevented with the help of calendula. Okay. Traumatic and idiopathic neuroma. Traumatic neuroma, this is one remedy, which is worst remedy we have learned, LMCPA, where there is traumatic neuritis we have discussed. There is a severe neuralgia in the stump after amputation that we have learned in while learning the LMCPA. And this is the remedy which is also important for the same purpose. So whenever there is a severe nerve pain, this remedy plays very vital role. See, it has been given in brackets SIPA. SIPA means LMCPA. Okay. Neuritis from lacerated wounds. Neuritis is inflammation of the nerves from lacerated wounds. Whenever there is a laceration over the wounds, the pain is severe. Whenever you just see, whenever laceration is there, pain is more. When you have broken bones, that is not so severe as laceration has. Hypericum is one remedy, but whenever hypericum is there, whenever the nerve damage is there or nerve injury is there, it is very close. Nerve injury, hypericum, calendula, for local purpose it heals. Hypericum you can give internally if it is neuritis or nerve pain, nerve damage. Traumatic idiopathic neuroma, exhausted from the loss of blood and excessive pain. So patient is exhausted because of loss of blood and because of severe pain. Calendula plays very, very vital role. In fact, what I have done when I was working with Dr. Nitin Bagri sir, I used to keep a big bottle, 500 ml calendula, and we used to use for every case this remedy. And in my practice also, I used to give calendula mother tincture to all the such patients, and I asked them to put it on their wounds. This is wonderful remedy which heals. Rupture of muscles. See, this is one more important. Rupture of muscles or tendons. Underline. Remedy is here you have to use it in globules forms. It is given internally, not locally. Lacerations during labor. This is one more thing where I used to use this remedy in labor cases. My wife, she is a gynecologist, and we used to, whenever the labor cases are there, there are many a times it happens that there are lacerations at the labia and internal cervical tear sometimes happens. This remedy is a very important remedy to heal that with first intention. Wounds penetrating articulations with loss of synovial fluids. Whenever the joint pathology is there, whenever joint gets disturbed because of injury, and because of which when there is a loss of vital fluid from that synovial fluid is lost, at that time calendula plays very vital role in the healing purposes. So open joint injuries, put calendula, it prevents the secondary bacterial infection. At the same time it heals that with fast primary intention. Wounds. What type of wounds? Wounds with sudden pain during febrile heat. So wounds where the febrile heat, fever is associated. Constitutional tendency to erysipelas. Erysipelas means inflammation of the upper layer of the skin, the superficial layer of the skin. It becomes absolutely red, inflamed, either because of injury, either because of some infection over there, specifically staphylococcus infection in the skin. Erysipelas is the most important thing. Soranum is one of the important remedy which I used to use as an intercurrent whenever it is not healing. Calendula locally plays very vital role for such types of infection. Wounds, old neglected. Kasha wounds आहेत? Old, neglected, which you are neglected. Wound, offensive. The discharges are offensive. Then, threatening gangrene. Threatening means होऊ घातले, which is not yet happened, but which will going to convert, maybe going to convert into the gangrene. At that time, the calendula locally plays very vital role. It is in bracket, it has been written salicylic acid. It is not salicylic acid, it is sulfuric acid. This is wrongly written everywhere. It is SUL. It is a printing mistake. 2-3 times of happened over there. This sulfuric acid threatening gangrene. Sulfuric acid is a wonderful remedy to prevent gangrene as well as to heal the chronic wounds. So it is sulfuric acid. Make it clear in your book. It is not salicylic acid, it is sulfuric acid. Then he explains about the ulcers of calendula. So ulcers of calendula are irritable. Irritable means they are very irritating, causing severe pain, irritation in the mind. Inflamed. Ulcers associated with erysipelatous condition, inflamed. Sloughing. Sloughing means there is lot of debris, discharge, pus coming out. Varicose, ulcers, varicose, associated with lot of vascularity, dilatation of veins, painful as if bitten like arnica. So it is as if something have been bitten over there. That type of pain is present in ulcers. Ulcers with excessive secretion of the pus. So lot of pus is coming out. Put the calendula over there to prevent the suppuration and to heal the wound. This is wonderful remedy, one should not forget. Calendula is almost specific for clean surgical cuts or lacerated wounds to prevent excessive suppuration. See, this is too important. What he is saying? To prevent excessive suppuration, for the purpose of heal, for the lacerations, for every soft damage, these remedies should be used in mother tincture form locally, and it works. So this is what calendula is there. Arnica, where is blunt trauma is there. This is a remedy where this remedy is there for local application wherever there is a injury which is lacerated, which is open fracture. To put calendula locally, wonderful results. Relations, complementary. There also word is wrong. It is hepar. HEPAR, hepar, hepre or something has happened over there. Change it. And sulfuric acid, not salicylic acid. In the book, these are printing mistake. Hypericum and sulfuric acid. These are two complementary remedies to the calendula. So once you use the calendula and you want a result better, these are little bit deep acting remedies which you have to take into consideration. Hepar is very deep acting remedy. Sulfuric acid is also deep acting remedy which works if needed. Similar to hypericum in injuries to the parts rich in sensitive nerves where pain is excessive. So wherever pain is excessive, this remedy, hypericum, is very close because hypericum has nerve trauma and out of all proportion to injury. So in hypericum, neuralgia is more marked because of nerve injury. So whenever there is spinal injury, hypericum plays very vital role. Whenever there is many times uh, we used to do a lumbar anesthesia, spinal anesthesia. It is an injury happens to the nerves. Two remedies you must think. First is hypericum, second is ledum pal. Both remedies are very important over there. Similar to arnica in traumatism without laceration of the soft tissue. So whenever there is a without laceration, arnica is there. With laceration, calendula is there. Staphysagrea, yes, I am going to discuss that remedy later. Yes, it is also one of the very important remedy in clean cut wounds. Sure, definitely. Symphytum and calcarea phos for non-union of bones. So whenever there is bony injury, these are two important remedies one should not forget. Symphytum as well as calcarea phos. And those we're going to discuss in this session because all in nerve, all the wound injuries I will going to share one by one. So that will be better for comparison also. Again, word is wrong. Next line, it is salicylic acid is written. It is sulfuric acid prevents excessive suppuration and gangrene. So you can cross check in the books. You can get that sulfuric acid is the very important remedy for excessive suppuration and gangrene. Same thing, same role played by calendula. Sulfuric acid is used internally and this is used externally. Yes, Manjeri, definitely. That's what I want to share with you. For ACL tear, for meniscus tear, this remedy works beautifully internally when given internally. And sulfuric acid is painful gangrenous wounds said to destroy the septic germs. Yes, definitely sulfuric acid is a very good remedy for that. Acts as well as in potency as in tincture applied locally and may be administered internally at the same time. This is related with the calendula. Calendula is the remedy which is used specifically locally many times in wounds, but internally, whenever there is an internal injury, for example, ligamental tear, for example, meniscus tear, for example, muscle damage, sometimes sprains of the muscles, and for the purpose of healing, calendula internally works beautifully. So see, when we learn remedy, we must compare the remedies. We have started with arnica and next we have discussed the calendula. We have to discuss one more remedy again for the injury. So injury becomes clear in our mind what to use and what not to use. Ligamental tear, yes, sir. You can use the 30 or 200. 200 is better potency or 30 is also good remedy. Potency depending upon the susceptibility. There is one more question, vaginal dryness and pain after hysterectomy for patients. Hysterectomy done long back. Can we give calendula? Sure, definitely. It is a very important remedy for that purpose. You can use. Definitely. Uh, how to use that? I have told you that in a that magga jar of water, 20 drops in a warm water. It is not hot and it is not cold. It is warm water and add 20 drops and use locally. That heals that part. So calendula is a very useful remedy in our day-to-day practice for such purposes. So should not miss this remedy or for all rest of the things. There is one more question. For wounds, we have to mix it with water or mother tincture. My suggestion is that it works directly. It is little bit pain. It produces burning for a moment. After 15 seconds, burning disappears. But it heals very fast if you use directly. Sir, I want to ask about arnica. Can I ask? Yes, yes. Put your question over there, so I will answer. We have 5 minutes.
Sir, Utpal Pal here, sir. Dr.
Hmm.
Utpal Pal. Sir, local application of echinacea. Sir, can you discuss
Local application.
of echinacea? Echinacea mother tincture, sir.
That is also one remedy. That still we have to learn. We are learning calendula. Echinacea is mother tincture is also good. But for the purpose of granulation, specifically big wounds, calendula is the exclusive remedy.
Sir,
Hello, sir.
Huh?
in which case, sir, we can use echinacea, sir?
I will discuss that while discussing echinacea. Because it
Okay, sir.
makes the
Thank you. Thank you.
confusion. Better first learn calendula thoroughly. Then we'll compare calendula
Okay, sir.
and
Thank you.
echinacea. Yes.
Hello,
Okay, sir.
sir.
Thank
Good
you.
evening.
Huh?
सर मला विचारायचं होतं आर्निका इज अ इंजुरी रेमेडी सो हिअर वी हॅव टू टेक ओनली फिजिकल इंजुरी अँड नॉट द मेंटल इंजुरी ना
Actually, during proving, we get all those features. Many times people use with such types of thoughts, but unless and until it has been confirmed with the help of mental picture of the arnica, you should not. Because then we lose the homeopathy when we start theorizing, fantasizing. So instead of that, utilize it as it has been proved. Our definition of homeopathy is same, and whatever is there, whatever the proving symptoms are there in our materia medica, on the basis of that we can use the arnica. So this, my suggestion is always there to utilize it in that manner. Arnica mental symptoms are different. That if they are present, yes, while talking, patient goes into the again into the stuporous condition. When patient says there is nothing matter with him, all those things are there. Yes, definitely arnica plays the role. So don't try to make it metaphorical. You lose the thread. You lose the basically the present state of the person because of which.
ओके
For
सर
fungus, how to
सर
use
Yes, there is one more question from Nandini. Yes. There is one question, sir. If we use it
हेलो सर
locally, yes.
Sir, I want to ask कि in post-operative cases, suppose for example after operation of cataract, if patient gets vitreal hemorrhage and all, then in that case the operative procedure can we take it as injury and give arnica or we
Yes,
have
it is an
to
injury.
means
It is
think
an
of belly
injury.
spur.
Yes, yes, you can give. Definitely.
But sir, how we can differentiate it from belly spur because belly spur is
Belly
also
spur
used
is a
in
different remedy that we're going to learn within 3-4 days. I will share that
Okay, sir.
difference whenever I will discuss the belly spur, because belly spur has a different types of injuries. Definitely.
Okay.
But one
Thank you,
important
sir.
remedy is arnica. You can use internally whenever eye trauma is there because of operation.
Okay. Thank you, sir.
Maithili, she has asked, sir, if we use it locally, how to use, in which cases, whether in mother tincture, how much, can we use it in cleaning wounds, like use of Dettol? That's what I have discussed just now. Yes, locally, directly as a mother tincture, and directly as a mother tincture. After tooth extraction, to put it locally, it's good, but how many dentists will going to do it? It depends upon dentist. It heals. I used to ask regarding the calendula gargles. It definitely works. Okay. So that's all for today. Thank you being there. And we'll have again tomorrow session with one more remedy. Again, wound remedy we're going to discuss tomorrow session. I will let you know tomorrow which remedy. So thanks a lot. Any other query is there? Is there any query?
sir, for fungus in the groins? Fungus in the groins.
Yes.
We have to use mother tinctures and also internally this
Mother tinctures locally.
locally and internally also can we give?
Internally, I never used calendula for that purpose. Internally, there are many remedies depending on symptom similarity because it depends upon the modalities. What type of modalities are present? What whether that itching is aggravated by scratching, itching is aggravated by cold water, itching is better by warm water. Any modality. Whenever we used to give the internal remedy, it should be on the basis of symptom similarity. Externally, we are using this calendula for different purpose. Here, there is no action. It is not on the basis of symptom similarity. It is directly action, pathological action of the calendula we used to use over there.
Thank you, sir. Thank you, sir.
After suppuration, yes, definitely it used to work. 100%. Okay. So thanks a lot. We'll meet tomorrow in the 6:30 with our 6 o'clock organon session and 9:30 with the Mathemedica session. Thanks a lot to everyone.